Hello, I'm Dr. Roberta Dwyer. I'm a veterinarian at the Gluck Equine Research Center at the University of Kentucky. And what we're going to cover today is the general overall anatomy of the horse. Behind me is a horse skeleton that is almost totally complete. I will show you which bone is missing from the skeleton, but we're very lucky to have an entire skeleton of the horse so we can teach anatomy and physiology to our students and to all of you. The average horse size is anywhere from 14.3 to 16, 17, or even 18 hands tall. The average light horse that most people will ride, including quarter horses, Morgans, Appaloosas, is anywhere from 1,000 to 1,500 pounds, depending again on their height and their overall size. The actual horse skeleton has a little over 200 bones. We're not going to go over all 200 bones today, however. We're going to go through two distinct general divisions of the horse skeleton. One is called the axial skeleton. I like to break down big things like 200 some odd bones of horses into smaller pieces. So we're going to break it down to two pieces. The axial skeleton starts at the head and includes all of the vertebrae, the cervical vertebrae of the neck, the thoracic vertebrae of the main part of the back, the ribs, and the ribs will connect through some cartilage to a breastbone or a sternum. That's the one bone that's missing from this body because the cartilage disintegrates when these bones were processed to actually construct the skeleton. So there is a breastbone just like we have, but it's not on this skeleton. So continuing with the axial skeleton, here's a thoracic vertebrae, the lumbar vertebrae. There's a fused set of 5 bones back here called the sacrum. These are fused together. And then obviously in horses you've got the tail vertebrae. Those are called coccygeal or caudal vertebrae. And those vary in number depending on the breed and type of horse. So that is the axial skeleton. The second division of the skeleton of a horse is the appendicular skeleton, or the appendages, the front legs and the back legs. So we'll start with the front legs, and it's just like people. You know, we're very comparable. We have a shoulder blade or a scapula. The horse has a scapula down to the humerus, which is the same as ours. They have an elbow, which is part of the ulna, but the ulna in horses is fused to the larger bone, or the radius, which is our forearm bones. The carpal bones down here, which there are several of, equate to our wrist bones. Most people call this the knee, and that's lay terminology, which is fine as long as everybody understands what that is. But this is actually the equivalent of the wrist in the person. Then there's 3 bones down here that we'll go into more detail in another segment. These are the metacarpal bones, the sesamoid bones, and then the phalanges, the long pastern bone, the short pastern bone, and the coffin bone. So this is the front limb of the animal. The hind limb starts back here with the pelvic girdle. And if you've ever been riding, and it's been a long time since you've been riding, and your seat bones are sore, that's the equivalent to this part of the skeleton on the horse. This is their seat bone, but they're a horizontal animal and we're a vertical animal. Then the thigh bone, or the femur, which is the same as our thigh bone. This bone right here is the patella. And this, anatomically, is the knee as it equals the knee in a person. This large bone here is the tibia. And in people, we have a tibia, but we also have a fibula, which is on the outside or the lateral side of our leg. Those bones are fused in the horse, so they don't have 2 bones here, they just have 1. And then you have the equivalent of our ankle with the hock bones here. And then again, we'll go into more detail later on with the cannon bone or the third metatarsal bone, and then the long pastern bone, the short pastern bone, and the coffin bone. So that's just a general overview of the skeleton of the horse. And we will get into more distinct pieces of the anatomy of the horse in a later segment. If you'd like more information, you can go to thehorse.com, talk to your veterinarian about different anatomical sites that you're interested in on the horse, and of course your public library is very good source of information. Thank you for sharing this time with me today, and hope to see you in the next segment. Hello, I'm Roberta Dwyer. I'm an extension veterinarian at the Gluck Equine Research Center at the University of Kentucky. In this segment, we're going to be focusing on the bony anatomy of the front limb of the horse. Their anatomy and our anatomy of our arm versus their front limb is extremely similar. Horses have a shoulder blade, just like we do. The one absence in the horse skeleton versus the human skeleton is they don't have a collarbone. They don't have any bony attachment of the front limb to the rest of their body. The way this limb stays attached to the horse's body is through muscles, tendons, ligaments, and other connective tissue. So while we have a collarbone, which is a bony attachment of our arm to our body, the horse is all connective tissue. So here's the scapula, then we go down to the humerus, and if you consider this joint in the human, we can do a lot of different types of rotations and movement with that particular joint. How many times have you ever seen a horse do this with the front leg? That doesn't happen on a normal animal. That's because anatomically this joint is meant to go forward for locomotion, to move the front leg back, and to go minimally side to side. So for the dressage horses that are doing half passes, those are the types of movements that this joint is actually doing. Here's the humerus. We have an elbow, horses have an elbow. Our elbow and the horse's elbow is part of the bone called the ulna. And the ulna in the horse, obviously it starts out here at the elbow, but you can see it goes down to a very vestigial piece of the bone that's actually fused to the radius. We have a distinct ulna and radius, two separate bones. These are fused in the horse, a little bit different. So that's the forearm. The next set of bones is the equivalent to our wrist, although people will call this the knee, and these are carpal bones. There's two layers of carpal bones on the horse, and I always teach it from the medial or the inside of the animal going to the outside of the animal. The top row of carpal bones starts with a radial carpal bone. Then the next bone here, which is right almost on midline, is the intermediate carpal bone, the ulnar carpal bone, which is on the lateral side, and the accessory carpal bone here. The next layer down also starts on the inside with the second carpal bone, the third carpal bone, and the fourth carpal bone. If we move down, we've got to our wrist. Now we go to the long bones of the hand. In horses, everybody knows that this is the cannon bone, and that is the third metacarpal bone. Here on the inside is a nice splint bone, which we call the second metacarpal bone. The third metacarpal bone is the cannon, and on the lateral side is the fourth metacarpal bone. Now that's the equivalent of 2, 3, and 4 on the human hand, and you might say, where did 1 and 5 go? Over evolution, those particular bones disappeared. They've evolved now to where you've got splint bones and the main a huge weight-bearing bone and very dense bone of the cannon bone. Again, going south, we have two sesamoid bones, the medial and the lateral sesamoid bone. And what we generally know is the long pastern bone, the short pastern bone, and the coffin bone are actually the first, second, and third metacarpal bones in the horse. And you might say, isn't that enough? But there's one bone that we're missing that's very hard to get a picture of when you've got an entire skeleton like this, and that's the navicular bone, which is just behind the coffin bone. And it's a slab-like bone. If you've heard of navicular disease, that is where this bone is within the hoof and can cause some problems with horses. So navicular disease, a lot of lamenesses with horses start in the hoof. Another area where they can have lameness, especially in young horses and athletes that are doing a lot of exercise and a lot of work, is with this metacarpal bone. There's a ligament that attaches it to the main cannon bone, and sometimes that ligament gets inflamed. Sometimes there's a partial or complete fracture of this particular bone, and that's commonly known as splints. So if you ever have a lameness in your horse and an abnormal swelling, heat in a joint or anywhere around the lower leg of an animal, that's the time to call your veterinarian. If you'd like to have more information on the anatomy of the horse's leg and other lamenesses, you can go to thehorse.com. You can contact your veterinarian and obviously use the resources that you have at your local public library. I'm Roberta Dwyer. I'm a veterinarian at the Gluck Equine Research Center at the University of Kentucky here in Lexington. In this segment, we're going to cover the general anatomy of the hind limb of the horse. The hind limb of the horse actually starts with the pelvic girdle, and that is this whole set of bones. There's 3 bones. There's the ilium, there's the ischium, way back to the end here, and this bone here is called the pubis. That is there's 3 bones, but by the time the animal is an adult, they're fused into, essentially one bone. From this pelvic girdle, we have the first long bone of the hind limb, which is the equivalent to our thigh bone. It's called the femur. This is a very large bone in the horse, obviously. And if you connect your thigh bone, connects to the knee bone or the patella. This is the actual knee, the human equivalent of a knee in the horse, whereas most people will call the front limb of the horse, the knee is up there. Anatomically, the knee of a horse and a human is the hind leg or the lower leg on a human. This is the patella. It slides up and down in this groove just like it does in people. Going further distally, we have the lower bones here, which is the tibia, which is this big bone, and the large bone on our body. In dogs, cats, and people and other animals, we also have a very thin bone on the outside of our leg called the fibula. The fibula is essentially fused to the tibia on the horse, so we just essentially call this the tibia on the horse. Just like in the human, the tibia is going to connect down to our ankle bones. These are called the tarsal bones. So these are the tarsal bones of the horse. This is the calcaneus, and this connects to the calcaneal tendon, which we know as the Achilles tendon. So it's a large tendon, and it is very important to the locomotion of the horse. So this is the calcaneus. This is the talus, this rounded bone here. And then there's a central tarsal bone. So this is the first row of tarsal bones in the horse. And then just like in the carpal bones in the front limb, you have the second tarsal bone, the third tarsal bone, and on this lateral side, the fourth tarsal bone. This is going to sound really familiar from the front leg, where we have the metatarsals. Front limb is metacarpals, the hind limb are metatarsals. Splint bones, this is the second metatarsal bone. The cannon bone is the third metatarsal bone. And here on the lateral side is the fourth metatarsal bone, just like the long bones in our feet. Going farther down from here, we have the 2 sesamoids, the medial sesamoid, which is here, the lateral sesamoid, which is on the outside of the animal, which is here. And again, this is going to look real familiar, the long pastern bone, the short pastern bone, and the coffin bone, or the first, second, and third phalanx, just like in the front limb of the horse. And again, we have the navicular bone, which is just caudal to the coffin bone. So this is the general anatomy of the hind limb of the horse. If you need more information, you can go to thehorse.com, contact your veterinarian, and use resources on the internet and also at your public library.